If you've bonked your head on the ski hill, and even if you didn't lose consciousness, you're now part of the TBI Club. TBIs, or traumatic brain injuries, are a risk all skiers and snowboarders take the second they slide on snow. They're the leading cause of trauma in Summit County, and across the nation, up to 3.8 million people suffer a TBI from sports every single year. TBIs come with the territory, but experts know more than ever before about how they affect the brain and how to manage the worst symptoms. St. Anthony's Summit Medical Center has led the charge with its Impact-Free program. They bring TBI training to Summit High School and sports clubs across the county, but they also host support groups for locals suffering the worst of TBI symptoms. In the thick of ski season, we talked with program coordinator Jen Kagan to learn more about TBIs, how they fit into skiing and riding, and what you can do to keep your brain safe. Phil Lindeman, Krystal 93 News Director, and we are here in the studio today with Jen Kagan. She's the Nurse Program Coordinator for Traumatic Brain Injury at St. Anthony's Summit Medical Center, and we are talking concussion. Jen, thanks for making time to come in today.
Sure, thanks for having me.
Of course. And we just got done with one of the most exciting times of the year here in Summit County. We had Dew Tour, and we had Grand Prix, and we had Rev Tour, and we had everybody throwing down in the half pipe and on slopestyle courses. And of course, we also saw some injuries. Now tell me how concussion fits into ski and snowboard injuries. Is it one of the top reported injuries here at the medical center?
Yes, definitely is. Traumatic brain injury, which includes concussions, is the number one trauma diagnosis in Summit County and at Summit Medical Center. So we see, unfortunately, plenty of concussions, both through the ski season as well as the busy summer season.
Yeah, and usually those concussions, are they generally tied to activity? You know, the fact that everybody's out here playing?
Usually, yes. Skiing and snowboarding being the number one cause that we see, at least in the emergency department at Summit Medical Center. But we live in a high alpine environment where I'm sure many of us have experienced just walking outside to our car and slipping and falling. But those aren't the fun stories, at least.
Yeah, true. Well, I was going to say, but a head injury, it doesn't know anything cool to do. It'll happen to you whenever
Exactly.
It manages to happen. So one of the leading causes here, or one of the leading reasons why people are brought to the ER, generally, what's the range of traumatic brain injury? So they range from, mild bonks on the head to very serious. Kind of what is the
Sure.
spectrum for brain injury?
Well, we used to grade concussions, and I keep talking about concussion, which is a traumatic brain injury, but that is often considered a mild traumatic brain injury, and most of what I would say, see at the hospital and at the mountain clinics. The range can be a very severe traumatic brain injury, which can involve a skull fracture, a bleed or hematoma or bruise on the brain. Even a stroke is a brain injury, although it doesn't necessarily involve a trauma or traumatic injury. So they can range to very severe to, I would say many of us have experienced a mild traumatic brain injury, which is a concussion, where maybe you are riding on your bike or you're skiing, you're wearing your helmet, you fall, you don't even lose consciousness, but you just don't feel 100% after that fall. And that could be considered a mild traumatic brain injury.
Yeah, and that's a good point. So I know, me personally, I've hit my head a few times. I've also hit my head pretty hard a few times. What are some of the things people can look for, if they do hit their head out on the mountain? What should, the signs and the symptoms?
Yeah, right. Well, very common symptoms would be dizziness, headache, sometimes some nausea, maybe even some vomiting. Confusion certainly is an indicator. Loss of consciousness, although you do not have to lose consciousness or even have any of those symptoms to have a concussion. So we always encourage everyone, if they've hit their head hard enough and they're not feeling 100%, to always be checked out by a medical provider, because it really is a very clinical presentation, which means everyone can present a little bit differently.
Yeah, and that's one of those things that we've been seeing in, say football, is that it presents itself very differently, and that's kind of why we have the new rules for football, especially at the high school level, that say, if there's any indication whatsoever, or maybe the coach even saw somebody get hit hard, pull them out and then they get cleared by a doctor. It's part of the
Right.
protocol.
Right. When in doubt, sit it out. And that's a big part of our program at the hospital for TBI is working with the high schools and a lot of the youth coaches in the community, and just doing education for coaches, for parents, for the athletes, for the students, and just let them know signs and symptoms of a concussion and when to seek help and how to help you recover.
Yeah, what are some of the other education pieces that go into that? So, obviously there's the very immediate signs, dizziness and nausea and some of those other things that happen. What else are you telling, coaches and parents to be looking out for, maybe even a few hours after the fact or days after the fact?
That's a good point, because a lot of times with the adrenaline in any kind of a traumatic injury, people may not notice their headache or their dizziness. They could have broken their leg, and so they have distracting injuries. So individuals may not notice till they get home after they've maybe had their legs splinted or their wrists splinted that, hey, I'm not feeling so great. I feel nauseous. I feel dizzy. Often, especially sometimes with adults, I'll get calls from patients saying, I've been off for a week and I just went back to work and I spent 2 hours at my computer, or I've been reading papers, or I've been trying to take notes. And it's not really until then that they try to get back to their regular activity that they notice that they're having maybe some difficulties with blurry vision or headaches that are kind of provoked by spending a lot of time on the computer or reading, or just kind of really deep concentration can sometimes spur on those symptoms.
Yeah, and like you were saying, especially when somebody gets back to normal and they're thinking everything should be going normal, but something is just a little off. Be a little aware of that. I do remember we were talking, when it comes to like the rest period, especially that athletes, like high school athletes need, that's part of the protocol as well, is a rest period. Screens. Right. How do screens fit into the rest period that people need after a concussion?
As in screen times, our cell phones and our computers?
Oh, yeah, absolutely. Yeah, like how much time we spend staring at all those things that give me a headache just when I'm staring at them normally.
Right. It's challenging because we tell both young athletes and adults to rest. Rest is the best thing to heal from a concussion, and that means both physical and cognitive or mental rest, mental stimulation, trying to avoid mental stimulation. And a lot of us are used to watching TV or a movie or looking at our cell phones to help us sort of decompress at the end of our day. But screen time can exacerbate the symptoms. So we don't tell people to curl up in a ball in a dark room and not do anything. But we do tell them to take breaks from the screens, from the computer and the cell phone. If a lot of your work is done at the computer, then take frequent breaks. Do 15 minutes of work and take a break. If you do 15 minutes and you realize, man, I have a horrible headache, or that's exacerbating your symptoms, then 15 minutes is too much for you right now. Break it down to 10. 10 minutes at the screen, 10 minutes off. And allowing yourself just to take naps, take frequent breaks, get out, go for a low impact walk. Not curling up in a ball, sitting in a dark room is not what we want to do.
Yeah, absolutely. Because, again, a brain injury is an injury. It's something that you need to rest and recover from, but it's also not something that you need to, maybe nurse to the point of. So any young listeners out there, this is not carte blanche to go ahead and not do your homework because you can't concentrate.
Right, right.
It's just a matter of kind of following what the doctor says and being aware of everything that you need to do just to keep yourself healthy and safe.
Right, and there can be a big psychological and emotional component to concussions and head injuries, where even in a mild traumatic brain injury, people can see that they are more irritable or more quick to, snap at their coworkers or their family members. They may find themselves more emotional, more tearful. And that's a big component to head injuries that we need to be aware of, that is just normal. And it'll get better. And allowing yourself that rest period and avoiding that extra stimulation will help you get through that.
Yeah, and here in town, of course, we I know that at the medical center, there's a support group that can kind of help people as they're going through, no matter what level of trauma you had. How does that work? What kind of stuff are people going through when they reach out to the support group there at the medical center?
Right. So we have two support groups, one for young adults, which can be, in some accounting, 30 and younger, but also, and then older adults. And it's for anyone with any kind of a brain injury, so stroke, anoxic injury, not just concussions and traumatic brain injuries. But we try to meet once a month, and sometimes we'll have a speaker or a special topic. Sometimes we just meet for a potluck and do fun stuff. We've had some art therapy groups. We've had some bowling outings. We've had some yoga retreats. And it's open to individuals who've sustained a head injury and are recovering. And also to their family members that may also be going through a rough time helping their family member or loved one recover.
Yeah. And is that an important part of concussion? Well, any injury really is to make sure that you don't have to do this alone. You can reach out to family, friends, support groups.
Absolutely. And depending on how severe the brain injury is, it can be difficult on the people around you as well, trying to support you and provide the accommodations that an individual might need to make the best recovery, just like with any illness or injury.
Yeah, definitely. And that's a good segue then into, so after a concussion, say maybe one that you sustained out on the mountain, you rung your bell, maybe even lost consciousness a little bit, you went to the doc, you took some rest. What are some things that people are finding are the long-term effects of a concussion or of a TBI, something that's
right.
that was caused by a fall?
Right. Well, the long-term effects of a concussion is not the norm. So that's the good news. I would say 80% of concussions heal just fine with the guidance of a family practitioner, your nurse practitioner, your physician assistant, with anywhere from a couple of days to 2 weeks of rest, a couple of weeks to rest. So that's the good news. Some of the long-term problems that people may see are headaches, vision problems, dizziness, ringing in the ears, sometimes neck pain, visual disturbances. But that really isn't the norm. So that is the good news. But again, I just want to emphasize that is why we really encourage anyone, no matter how severe, if you bonk your head and you crack your helmet and you're not feeling 100%, that's when you want to go in and get checked out. Go into the medical center, go into the ski patrol headquarters, go into the clinic at the base of the mountain and just let them know what happened and have them check you out and give you some information to help you make the best recovery possible.
Yeah, so don't try to self-evaluate what happened to you, especially after a head injury.
Exactly.
Because chances are you're not exactly evaluating as correctly as you would anyway.
Exactly.
But good to know that a lot of the impacts are not long-term, and especially if it's done, especially, it sounds like if somebody really does take care of their recovery, if you're
Yes.
very considerate in those first few days and weeks after a head injury, what can people do to stay safe? Right. I know we were joking earlier, just don't go skiing is one way to stay safe.
That's no fun, though.
Right?
Right. Of course, wearing a helmet. And I would say the majority of skiers and snowboarders out there that we see at the resorts are wearing helmets, which is awesome. And just so that you're aware, helmets are not made to prevent concussions at this point in our helmet technology. They're made to prevent skull fractures. So you can still sustain a concussion with a helmet, but you're going to sustain a lot less severe of an injury wearing that helmet than if you were not. So still, helmets with all high impact types of activities and sports.
Great. Do you recommend or do you suggest any particular brands or types of helmets that people should be looking for? Because it seems like these days just about anything you buy at a ski shop is going to be good. It's going to be what you need. It's going to be, made with the proper type of foam. Any ones that you particularly suggest to people?
I don't have any one type of helmet in particular that I prefer, but just making sure that they fit correctly. You don't want to see that helmet sitting on the back of your head. You don't want to see it over your eyes. You can bring your helmet into any ski clinic and and say, hey, I'm not sure if my kid's helmet is fitting correctly, and have somebody check it out for you. It's not rocket science, but sometimes it's obvious to see that some of the kids out there with the helmets, that they're not fitting correctly. So really making sure that it fits you correctly, and that if you crack your helmet visibly, it's time to replace it. And even if you impact your head hard enough with a helmet on to feel like, hey, I rang my bell, then that helmet has already done its job. Most of our helmets that we wear for cycling and snow sports are made to protect you from one impact, so that the foam or the interior of the helmet has absorbed that impact, and really to give yourself the best protection after you've hit your head hard enough to absorb that impact. It's time to replace that helmet.
Yeah, so like you said, even if you don't see any visible cracking, if you've hit your head, probably time to be looking into a new helmet. Because I know that I personally have had helmets where I saw maybe a little bit of a ding, a little bit of a dent, and I was thinking, oh, that's not too bad. Even that's the sort of thing that time for a new one.
Right.
Okay. Any other suggestions that you have for skiers, snowboarders, anybody else? When it comes to brain health and brain safety, how can we make sure that from helmets to everything else, we're keeping care of our heads?
Well, of course, motor vehicle crashes are also a big cause of traumatic brain injuries, and often more serious ones. So, of course, we're always encouraging seatbelt use and child seat use for children who are small enough. Also, the TBI program works with Think First, which is a brain and spinal cord injury prevention program, and they are big on emphasizing thinking first for the kids and adults, and making smart choices and avoiding those types of violent situations, or maybe decision to huck off a cliff to stay safe. And that's a really fun part of my job is getting out into the schools and the ski areas during Skier Safety Week, and educating the public about making smart choices and keeping their heads and brains safe.
Great. Yeah, looking ahead, when are some events coming up? Are there any coming up anytime soon in the next few weeks that have to do with brain injury?
It is Skier Safety Weekend is January, I believe it's 13th and 14th.
Okay.
And that's when Think First partners with Ski Patrol in the ski areas, and participants from Think First and volunteers will be at Keystone, Breckenridge, A-Basin, and Copper with booths providing helmets for low cost and fun information for kids and families about brain and spinal cord safety and prevention.
Great. So a nice way to be learning about it while you're right there at the mountain. You don't even have to worry about opening up a textbook. Well, great. Jen, thanks again for making time to come in and talk about concussion, especially right now at the start of the ski season. And finally, what can people do? How can they get more information from the medical center? Is it free to get?
Yeah, absolutely. My position as a TBI coordinator, I'm available by phone, 970-668-6121. And I can answer any questions, provide you resources, kind of direct people in the right direction to support or specialists if they're having a hard time recovering from a concussion or a brain injury. And really, we're there just to support the community and educate them and keep people safe.
Great. And of course, don't be afraid to reach out no matter what you think might happen to your head, because the only thing that can hurt worse is if you let it go totally untreated.
I agree. Yes, thank you.
Great. Well, thanks again, Jen. I appreciate you making time. Phil Lindemann on Krystal 93.